And okay, so recording again. Let's go back to the PowerPoint. So we're finished with that. Another view of the newborn. Here's the anterior fontanelle, frontal bone, these lambdoid suture, which will seal up. All of these seal up when the baby grows the first year, and all of these fontanelles form sutures. So the vertebral column, we have 7 cervical, C1 through C7, 12 thoracic, 5 lumbar, and then the sacrum and the coccyx. You should be able to uh, recognize cervical, thoracic, and lumbar vertebrae. Okay, so the vertebral column is very, very important. It's to give us backache and to make us remember that we used to be on all fours and that all our ancestors, the primates, not a single one eats meat or dairy or drinks cow milk. So my continuing challenge is to try to become a vegan. I know my son-in-law, Richard, the father of my granddaughter, says he lets a shooting dead and pull a steak out of his mouth. But steaks are killing people, dairy's killing people, and all of that waste developed by all the cows, pigs, and chickens, and they're treated terribly. Uh, they're releasing tons of methane, and they're polluting the planet and cause major change of climate change. Now that doesn't exist, but uh, well, my guess is that it does. Okay, so vertebral anatomy, what do they look like? So make sure you know that this is the typical vertebrae. This is a cervical vertebrae. It has a spinous process. It has a pedicel, a transverse process, a body, and a vertebral foramen. That's the window. That's where the spinal cord is located. So you should know the basic structure of a cervical vertebrae, a thoracic vertebrae. Notice that in the thoracic vertebrae, the shape of the loom of the vertebral foramen is circular and it's a very big body. It has a spinous process, it has a vertebral foramen, it has a pedicel, and it has a transverse process. This is where the ribs attach to the spine. We also have lumbar. Notice the difference in the size of the body and the shape of the vertebral foramen. So there's a transverse process, the spinous process. Uh, Pedicel is the connection of the transverse process to the body. This is the lamina. So you should be able to recognize C1 and C2, the atlas and the axis. Your skull sets on these two cervical vertebrae. It forms a joint with the uh, occipital condyles, and this is called the dens or the odontoid process. So you should recognize C1 and C2. So the sacrum is the base of your spine. It's a fused uh, vertebrae, and it articulates with the coccyx. If you fall on your bottom with a lot of force, you can break your coccyx off, and you have to sit on a round pillow. I have no idea if a broken coccyx heals. That's a good question. I don't know the answer to that. So you should recognize the sacrum and the coccyx. The sacrum is a fusion of uh, vertebra during the formation of the skeleton, when the cartilage skeleton in the fetus is converted into bone. Another view of the sacrum. All I'm going to ask you, coccyx sacrum. The thoracic cage is 7 pairs of true ribs. The ribs are attached to the thoracic vertebrae with a cartilaginous joint. The ribs also, the true ribs attached to the sternum. The false ribs don't have a direct contact. If we look at the sternum, we have the manubrium on top, the body, and the xiphoid process. Costal cartilages are the cartilages that connect true ribs to the sternum. And there's a much more indirect connection by the false ribs. So there are 12 ribs, 8 to 12 are false, 1 to 7 are true. Okay, here's another view of the thoracic cage. Webeson will ask you about the manubrium, the body, and the xiphoid process. I don't ask about true ribs, of false ribs, or floating ribs, but notice the 1 through 7 have direct contact with the sternum. So that's 1, 2, 3, 4, 5, 6, 7. And then these false ribs out here are connected to cartilage. And this is when you eat ribs, pork, when you eat pork ribs or cow ribs, you're eating all the meat that's around here. And if you go to Rudy's or a barbecue place, you're eating the muscles around these ribs. The pectoral girdle, you should know what the scapula is. You should know these parts of the scapula, scapulae, shoulder blade. So that's where the clavicle connects from the sternum to the scapula. You should know about the coracoid process, the acromion, and the glenoid cavity. And there'll be web-assigned questions where this will help you identify all the parts of the scapula. So my philosophy is that I pick out certain bones. I want you to know some markings, and WebAssign will correct it. You know that. And there are various views of the scapula. So this slide will be very helpful. The humerus, and the humerus is going to connect to the glenoid fossa. There'll be some questions on, I think, the capitulum, trochlea, condyle. So you should know the basic structures. This is called the surgical neck. When you break your humerus, it usually breaks right here. Then you have the anatomical net. This is neck. This is the shaft. So you'll be asked questions in WebAssign on these various parts of the humerus. Then you have the radius and ulna. Use this diagram to learn the head, the ulnar notch, and so on, the styloid process, the trochlear notch, and so on. There'll be questions about styloid process of the ulna and of the radius. All you got to know about the hand is ulna, radius, the carpal bones. You don't have to memorize these names. If you go on Google, you can find quite obscene ways to remember these bones. But all I want you to know is these are carpals, these are metacarpals, these are phalanges. The pelvic girdle, there'll be questions about the ilium and ischium and the pubis. This is the pubic symphysis. The sacrum is connected to the left and right portions of the pelvis. And we'll find that the ilium has a certain shape, ischium and pubis. So again, you'll be asked questions, I think, about the pubic symphysis and the acetabulum, the obturator foramen. That's that big hole in the the ischium. And here's the pubic crest here with connecting the pubic bone. Note, if you don't know it, that male and female pelvises are drastically different. Females have a different position for the sacrum and coccyx. They also have a much larger opening between either side of the pelvis so that a baby can be delivered. And notice the angle here, the pubic angle is much less than 90, whereas in the female, it is greater than 100. So you should know all of these bones. There'll be a lot of questions on the femur. And let's stop there and go back to stop recording for this. I probably have a pretty long one here. Stop recording.